We're going to start today our program. As you all know, I'm going to explain the drug sensitivity test. So I'm going to share the screen with all of you. I'm going to, let's see, more, stop, live stream, share. Okay. So we're going to start here in our World Smart Life Smart Dashboard. As you remember from last time, first of all, we have to log in into a Smart Life Solution dashboard. Here we have, as an example, Fabio's portal. He was kind enough to let us see his DNA test. So just a quick reminder, for you to have the NutroPack, we have to have the live log, the constant monitoring with our Halo device for 30 days, at least 6 hours a day. This is for the Oracle as the artificial intelligence program, to have enough information about your vitals in your up to date. Then also to have your DNA. As you see here, we have the live log 100%. That means Fabio has wore it for the past 30 days, and the DNA test and the assessment. All of this because the more information we have about ourselves, the more information the more accurate the Oracle can be, providing tips for us to improve on our health. So I encourage all of you to wear your Halo for at least 6 hours a day, constantly, every day. So we're going to jump into the DNA part. Then the DNA part, as you can see here, last week we spoke about the health and wellness genetic test. So we're going to scroll down. If you do your drug sensitivity test, it's going to appear on the same page report, and you're going to put here download report. Okay, so after you download report, you're going to have this. So many people have asked me, what's the need for a drug sensitivity genetic profile? And I'm going to tell you, well, there's many uses of the drug sensitivity. One of them is that you can simply shorten your time or trial of a therapy by knowing exactly a precise drug medicament that works for you. So I'm just opening this. I want to open it on, let's see. Okay, I'll just zoom in because I don't have, let me just try one thing I'm going to see in downloads. Not happening. Okay, yeah, perfect. So this is what I wanted, because now I can use a full screen and you can pay attention completely to my Okay, so here we are. Okay, so the drug sensitivity genetic profile, basically what we did was to create a summary of all up-to-date drugs that are currently available on the market. We clustered them under a specific type of medicine, and then we provide you an easy chart to understand by colors whether a drug fits good for you, or it's a fast metabolizer in your body, or you're a slow metabolizer. You're gonna know more about it once we go further on. So you have to know that this is available, or it's of use in all countries. Why? Because you don't need to have a special drug. These are all generic names, so you can use it in any part of the world. You just have to look for the generic name, and we have clustered them all into different disease type into their generic name. So we start the report. You can see here we have the levels of evidence, all the genotype, haplotype. This is all the scientific part. I'm going to skip that because it's the boring part. Luckily, you have me to explain you easily and not to have to go all the way through all of the pharmacogenomics and the explanation. One thing I do want to make clear, and I want to encourage all of you, is not to make any decision by yourself when taking this test. This test, it's we strongly advise you to use it with caution and with the help of your personal doctor, your healthcare provider, because true that we can improve on your health, we can improve on your therapy, but it is also necessary for your doctor to know which drug you're currently taking, and if you're going to make a change, your doctor needs to know. And I'm going to explain in the future why is it so dangerous for you to take action yourself without consulting a doctor, and why it is important for your doctor to know. So let's go further down. As I explained you, the report, we run over 600 drugs, generic drugs. We cluster them under each type of disease. As you can see here, you see the pain management, you see different types of anti-inflammatories or analgesic, antipyretic drugs. And as we continue further down, we're gonna see many different ones. We have for hypertension, we have for diabetes, we have for cholesterol, we have for antidepressants. All types of drugs are clustered into these charts, where the first row is the first column, sorry, is the drug class. So it's to what group of drugs it belongs to. The second column is the generic name of the drug. The third column is where the mechanism is involved. The third and fourth columns are where the specific biochemical pathway they are related to. This is just for medical doctors to know. This is none of your concern. You can dig more about if you want. You can just Google about this pathway that is involved. And then the last columns are the results. So I'm going to explain you. Let's see, let's choose a nice one to go for. As you can see, we have many drugs. This is very useful. I recently just did it for my grandma. I'm going to show the case of my grandma. My grandma has hypertension, and she's been on and off being controlled with her blood pressure. So I was doubting at the beginning, and that's what we doctor do. I'm gonna display this secret with you, but the first thing that we think as doctors when a patient is not getting healed is that we think the patient is not taking the medicine correctly. Maybe the patient is trying to, maybe he forgot or she forgot, maybe the patient is not taking it well in the schedule that it's supposed to be. That's why we're not getting the desired effects, because as we know from all the pharma research, we know that the drugs we're giving are efficient. They have been under a certain screening for knowing their efficacy. So we barely doubt about the drug efficiency, and we always translate the fault into the patient, right? Is it correct? Could be sometimes, maybe not some other. But what I'm trying to say is that for us as doctor, it is hard to know what's happening behind or after the patient goes out from our clinic, right? So it has been many times the case that patients have, they don't have a strict adhere to the therapy. So that's why the failure of therapy. But there's also the case of people who strictly follow the routine, the cycle and the schedule of taking the pills, the dose, everything as the doctor says, and they still don't get the results. So the genetics came right now to address this problem that the doctor had. And basically what we did was increase the dose. Sometimes if is the second, third time that we increase the dose and we don't see the desired effect on the patient, then only then we decide to change into a different drug. But with the DNA drug sensitivity test, we can shorten the amount of period, and we can avoid this trial and error between the doctor and the patient. I want you to understand that it is not the doctor's fault. It is not the doctor's desire to make you suffer, or for the doctors to make you come more often to the clinic for us to see you. But unfortunately, until a couple of years, this genetic test wasn't available. It wasn't available, and the only way for doctors to see if a treatment was going on well was giving you a specific drug, give you a dose, wait for a month, and see if it went well, if we have the desired effects or not. Either by, suppose my grandma measuring continuously her blood pressure, of if you're taking for cholesterol, for example, doing a checkup, a blood health checkup every 3 months to see if your cholesterol levels have lowered down. But that was the way to do it. That was the old way of medicine, of treating the diseases. But now it's way more easier, because every time you have a disease or you're going to the doctor, you have an appointment with the doctor, you take this DNA test with you. This is going to be like your instructions booklet, your cheat sheet for the doctor. You're going to take it with you every time you go into the doctor's office, because any drug that the doctor will prescribe you or your healthcare provider will prescribe you, it's going to be way more easier and way more effective if you show them this. So I'm going to explain you, as I told you, with the hypertension chart. So suppose I'm taking captopril. I'm going to show you. Let's see here. Suppose I'm going to show you my grandma. New share my screen. So suppose I have my grandma is taking this one, beta blocker, carvedilol, or Correg. That's the commercial brand. So she's taking this, and if you can see here, it has a red pill. that says may have increased toxicity. So what does this mean? This means that this drug, this particular drug on yourself, after running it with your DNA gene, it shows that it has a slow, it's a metabolizer. This means that this drug lasts longer in your body than it should be. So suppose if the drug is made for it to be taken twice a day, every 12 hours. This means that you take the first one in the morning at 7 a.m. and then at 7 p.m. you need to have the second dose. But because you're a slow metabolizer of this drug, by the time you take the second dose, you should have, or you should be close to be done metabolizing the first dose, the one from the beginning, right? So this overall, from day to day, you have an increased amount of this drug on your body. So you may start experiencing some secondary effects. It could be headache, it could be nausea, it could be whatever the secondary effects of that specific pill are. And then you may also tend to overload your body with this drug. It doesn't mean that it's not going to work, because it is going to work for hypertension, but you may have some secondary effects that you could be avoiding. So if you see here, go again to the first column, go to the beta blockers with alpha activity, and you can see that there's two types of drugs in this same group. Carvedilol, the one that we were taking, and then we have this second one that it's called labetalol. And if we see, labetalol has a green dot or a green pill, used as directed. So this means that this drug, according to your DNA test, fits, we can say, perfectly, or matches your body, and your body metabolizes it the way it should be, in the time it should be, the way it should be. So if we have the option of changing drugs, we're not only going to have less secondary effects, but we're going to be achieving the therapy in a better way than before. Let's take an example of an alpha-2 adrenergic agonist, because I want to show you what does a orange or a yellow pill means. And this means that your body is a fast metabolizer of this type of drug. So suppose if I'm taking tizanidine, or Sanaflex, the commercial name, as you can see here, this has an increased or a fast metabolism in your body. This means that your body, when you take it, it metabolizes it so fast that you might need to increase the dose to achieve the necessary effects that you need for hypertension, or else you should change. But suppose if you want to remain with tizanidine, you may say, okay, what's the problem? I'm a fast metabolizer, I only increase the dose, as we put here, 1.5. I increase the dose, so what? Yeah, you can increase the dose, but then you're going to be spending more. Because suppose if you take 1.5 every 12 hours, that means that instead of taking 2 pills a day, you're taking 3 pills a day. So instead of taking in 1 week 14 pills, you're going to be taking 21. So it's not cost effective, right? By doing this DNA, you can also save money by having the appropriate medicine tailor fit for your DNA without having to spend more or having to suffer of the secondary effects that some drugs may have. So basically, this is how this test works. It has a lot of codes here, but this is just the mechanism involved. You don't have to be afraid not to understand this. This is just for doctors to understand the metabolic pathway where it works. But overall, you have on one column the generic name, and then on the last columns you have either full efficiency, increased efficiency, or decreased efficiency. Or in other words, you're a fast metabolizer, you're an average metabolizer, or you're a slow metabolizer. I'm going to switch now to Facebook. I want to see some of your comments. Maybe you can, I'm going to enable the questions. See if you can, if you want to ask for some clarification. Hold on. Let's see. Okay, I'm going to, let's see all the attendees. Okay, I cannot allow the chat on Zoom, so I will request all of you, if you have a question, then go through Facebook. I'm going to look at the Facebook page, the live streaming. Let's see. Okay, I love this educational program, great knowledge shared, Terry Williams. Wonderful to see this education. Can you tell me more, providing that information or adding it to the report? Darlene is asking. Can you be more specific about the question? I guess I'm not following up. Then Juan Carlos Gonzalez, can you tell me more about this disease and the drug sensitivity test? What disease? Oh, I have a parent with cirrhosis hepatic. Okay, well, it is very easy. For all of those who have a chronic disease, say diabetes, say cirrhosis hepatic, say hypertension, gastritis, if you have allergy, it is very easy. We do the test. It is the same way we do the wellness test. It's a cheek swab. We fill some questions. We fill out the assessment questionnaire. Has some questions about what drugs you're currently taking, what are the dose. So that's why we require the signature of the physician, because we want to be accurate on this part. So you go to your doctors, you ask for the doctor to complete the assessment on you based on the current drugs you're taking. Then he's going to add the signature, and you're going to take the cheek swab again. You mail it to us. We're going to pass your DNA and identify your DNA through our machines and give you this report. This report doesn't matter if you have hypertension or if you only have diabetes, if you're taking antidepressive pills. The report we're going to generate includes the almost 600 drugs. It's 570 to be exact and to be precise. We provide all of them to you. So you're going to have a booklet of information that you're going to carry every time you go to the doctor. You don't have to take it again because your DNA doesn't change. Hopefully in a couple of years, when drugs change, we're going to update our booklet But for now, these drugs are the ones that are currently available on the market. So you don't have to worry about taking this test every year, because that's not the intention. The intention for you is to have this DNA test, and every time you go to the doctor, then you can bring it for the doctor to give you the therapy for any disease that it's going to give you. But to be more precise, let's shorten the time of trial and error, and let's just be precise with whatever the doctor is giving you. Yes, Juan Carlos Gonzalez. So with this, we can change all the actual protocol to an effective one. If the actual protocol is not working, yes, we can change it. It doesn't mean that the current drug you're taking, it could be the one that your doctor chose is the appropriate one. We don't know. But what we're trying to incentivize people is to raise awareness that there are better ways for you to address a disease. Let's, as I said before, let's stop the trial and error, and let's go and focus to whatever it's already proven to be good to your DNA. Let's see if you have any more questions. Okay, I'm going to address also why I don't recommend you to change after doing this test any of the drugs you're currently taking by yourself. And the reason is some of the drugs may have secondary effects, right? So suppose you have you're taking for hypertension, but you also have renal impairment, or you have also diabetes, so you have some renal impairment. So maybe the doctor is giving you a specific drug for hypertension that he or she knows that won't affect your kidney disease from diabetes. If we change ourselves because we decide to do the test and not to consult with a doctor or a healthcare provider, if we do it ourselves, we can even harm ourselves. And instead of doing good, we're going to end up in the ER room by doing this thing by our own. So I strongly recommend all of you, don't be brave enough to do this change on yourselves. And every time you want to make a change, you have to inform your physician, and your physician is the one who has the last word. Remember, we only see one part of your health, that is the DNA or your genetic profile, but we cannot know what other comorbidities or what other diseases you have. You may have or you may not have. That is responsibility of your physician, and that is why your physician is the one who is with the entire faculty to allow a change or not. Yes, you do need to have our primary care provider signature. Why? Because that way we ensure that you're on talks with your physician, and that you're not going to make the change on yourself, right? I'm going to screen a little bit further down to let you know what other drugs we test for. Let's see here, we have antihypertensives, we have treatment for angina, dyslipidemia, this is for cholesterol. We have many drugs for cholesterol. Anticoagulants, we have here many people taking warfarin or Xarelto. This is very common on after the 60-year-olds, clopidogrel, Plavix. Many people take these drugs. We have here for respiratory function, we have steroids here. Antiemetics, this is for nausea. Let's see here, we have for peptic ulcers, gastritis, reflux, esomeprazole, omeprazole, and lansoprazole. All of these are very common, and many times they're prescribed by doctors, but the efficacy is not that well because we're not taking the correct one. These people who are taking for obesity or gastrointestinal disorders. Here are for diabetes. You can see all of the drug classes, the different types of drugs. Here we have antihistamines. Look for migraine, for antiallergics, hyperparathyroidism. It is very comprehensive report. I really love this. If all of my patients, when I'm at the clinic, would come with this would be really easy to address the problems, because many times patients come failure with therapy. They tell you, doctor, I've been taking the pills as directed. I'm not getting the desired effects. I'm starting to get frustrated. What do I do? And sometimes we're just like, we cannot do more. We change, but we change from drug blindly because honestly, we cannot know which one is going to be better on your body. But with this report, this is a magic solution. Here, look, antidepressants. We have for all the psychiatric diseases. We have many types of drugs. Antipsychotics for anxiety, Xanax. We have some neurological drugs, epilepsy, anticonvulsants, muscle relaxants, anxiolytic. Look, it's all very complete. And the good thing is that it's all included. It's not that if you have diabetes, we will only test it for diabetes. No, the PGX report, it's all included in one, and you can have it, save it, and store it, or give a copy to your doctor, so you don't have to bring it every time you go to your doctor's appointment. Look, antibiotics. Many times, as you know, I'm going to address antibiotics since we have a little bit of time. I've only been for half hour, so I'll bore you for another couple of minutes. Many times, if you use too much antibiotics, you can develop some resistance. And whenever there's a bacterial infection, I can go from the most simple antibiotic that exists. But maybe if I had this, I could know which one is better for you. So at least I know that we use antibiotics at least once a year for every patient, twice a year for any infection. This is antifungal. We have some antivirals. So people with AIDS also can know which ones are better or work better in our body. If we have herpes, look, anti-neoplastic for oncology and hematology. We have some drugs tested. I really don't want to bore you. This test is more easy to understand. It's not like, well, the wellness and test is also very easy, but what I mean is that there's no much to talk. I explained you once how it works. We have the drug class, we have the generic name, the genetic mechanism involved, and then either orange, green, or red. It's very easy. I'm going to jump on Facebook to see all of your comments. Look, immunosuppressive therapy. Even for anesthesia, look, we can see which one works better. We can avoid so many complications by knowing this. This is for prostatic hypertrophy. Okay, so let's move on. I'm going to switch into Facebook. Let's see all of your comments. Yes, when you receive your report, this is it. Antibiotics is a big one. Yes, MLD. Sometimes we give the wrong antibiotics. This information will be available in the back office. Yes, it will be available. Thanks, Juan Carlos. I believe the last time I read you, you're in Mexico. So hello from Mexico. Yeah, we have some for AIDS. Immunosuppressants are for AIDS. Then we also have antiretrovirals. They're used for AIDS. So you can also know which drugs to use. It is very general. We're not doing any specific disease. We're just clustering the drugs that exist. We're not inventing anything. All of these drugs are available on the markets. But why no one else has done it? Well, it is not of the interest of the pharma companies to tell you which one it works or which one it doesn't. Why? I'll let you do the conclusions, but this way we can save some money and also save some time when we're having our therapy. So I encourage all of you to do it. It's very useful and it won't change. Okay, so I think that's all. I'm not receiving on Facebook. Please, the ones who are looking at me on Zoom, I'll give you one more minute on Facebook. If you have any questions or comments, I would love to address them. If not, also leave your comments about the time. Is this the correct time? Some of you, I see that have to wake up very early. Should I change the time? If you want me to address some other health topics, give me some ideas. I would love to address them. Of course, I already have a schedule of topics, but I will try to address them and to give you some more information on an easy manner for you to understand better and for you to improve on your health. That's the main objective. Improve on your health, know yourself, and empower you to live better. Should a person be off of all supplements for a week before they do a swab? No. The swab takes your DNA, your genetics, so it doesn't matter. What we take, it's some of your dead cells in your mucus, so no need of taking off of any supplements. The only thing we ask is to rinse your mouth if you have eaten or drink something before you do the swab, not to contaminate the sample. That's it. So I'm very happy that all of you like it. I will be finishing now. So warm hello and goodbye to all the world changers. I hope this helped you and see you next time. Bye-bye.